to the Q&A related to the Safe Sleep and Breastfeeding presentation that Rebecca Huber from AMCHP just so masterfully gave to us via video. We are honored to have Rebecca here in person to address any feedback or questions or to engage in discussion with you all. I'm Stacy Tuck from AMCHP, by the way, and if you have any logistical needs, you can either chat me here, or pretty much though, I'm just going to let Rebecca kind of take it away, and I will be asking the questions that have appeared in the chat first of all, and then I'll give you all an opportunity to come off mute if you'd like. And if you feel comfortable sharing your screen, not your screen, but sharing your video, it would be great to see your faces. Otherwise, if you are doing this over lunch or something like that, it's totally fine for you to remain off camera as well. Thank you again, Rebecca, for being here, and thank all of you for being here as well. The
Thank
first
you,
question,
Stacy.
sure. The first question that is in the chat from the discussion is if you have any idea when AAP might be updating their safe sleep policies.
That's a really good question. I don't have any insights. I know that, a lot of bodies are moving away from abstinence-only approaches to safe sleep. I know the Academy of Breastfeeding Medicine is taking a more focused approach to risk mitigation, but I don't have any particular insights on the AAP. If anybody does, feel free to chime in.
Yes, I actually do. I attended the Cribs for Kids conference, the virtual one, and Dr. Rachel Moon spoke and said that they are going to have revisions that will come out in June, but they'll be published in July, I believe. So there are going to be some revisions coming out soon.
Oh, that's wonderful. Thank you for sharing that.
Fantastic. That's why we love having these group settings.
Yes.
For that update. Another question that's in the chat is regarding Georgetown's conversational modules. Rebecca, do you have more information that you could share about those modules?
Yes, I can also pop a bunch of links in the chat for folks if they want to review them independently. But essentially, Georgetown University had the first iteration of the NAPSIN project. That effort was led by Suzanne Bronheim, and they developed a series of conversational modules titled Building on Campaigns with Conversations. So these were conversational modules that were designed for a series of health professionals. So this included human service providers, community health workers, home visitors, and other supportive peer positions. A variety of folks who interact with families on the topics of safe sleep and breastfeeding. And so what we did in NAPSIN is we expanded upon these conversational modules with our national action team. So we developed a series of tailored usage guides to interpret the modules. So it highlighted in particular those that were most relevant to our network, which included perinatal helpers, safe sleep promoters, home visitors, and also grassroots organizations. And I'm happy to pop some links in the chat shortly to both of those resources.
Wonderful, thank you. And what are you envisioning, Rebecca, will be the next steps for this project on your end or at AMCHP?
Sorry, one moment. Just putting the links in the chat. That's a really great question. I think there's a lot of unknowns about the project right now. We've done a lot of really great work engaging with communities, and we'd love to continue that work. The project formally ends at the end of June. And we're certainly considering all opportunities. So if anyone has any suggestions, again, please feel free to chime in.
Thank you. At this time, I invite anyone to come off of mute and just give the general reactions about what you heard. Is it pretty reminiscent of the same types of information that you've been hearing in your respective work areas as well? or was there anything surprising or new?
It really resonated with me here in South Dakota. I do child death review for the state, and then also work in the infant domain for MCH. And we've really been struggling with just giving the recommendations. And we've been hearing on Safe Sleep, we've been hearing from our field staff that work with the clients directly that, that approach isn't working, and that we've been talking more about the risk reduction. So I was really glad to see that that's kind of what has come out of your focus groups. And actually at the Cribs for Kids National Conference, they talked a lot about that too, how the SUID rates have kind of stagnated, and why that is. And even Dr. Moon talked about risk perception. So yeah, all of this is very timely for us here in South Dakota.
I'm glad to hear that. Thank you for that feedback. I think, just a big impression that I was left with working on this analysis is just how, community approaches to safe sleep and breastfeeding are just completely not one size fits all. Like, we would have one community that would say they would have great success with one approach, and then someone within the same focus group would say, we tried that and that did not work for us. So there was a lot of nuance within our analysis. I see a question about additional communication strategies that were referenced in our interviews, such as handouts, TV and radio messaging, social media, their discussion of their impression, or was it centered on one-on-one provider education? All of those media forms were discussed at one point or another throughout our analysis. Handouts were really discussed with a lot of mixed sentiment, that we had some folks who really liked giving literature to their clients because it gave them something to refer back to, but others did not want to overwhelm their clients with too much literature. So we had a lot of robust discussion and healthy disagreement and focus groups on that. TV and radio messaging was not referenced as much. There were some discussions of the usage of video education, but not necessarily using like television advertisements or radio messaging. Social media was discussed quite a bit. A lot of folks expressed some concern about how these spaces are not necessarily regulated, and some other informants had a lot of success by training individuals to be peer navigators within these social media spaces. So I know someone referenced that there can be quite a bit of misinformation on these Facebook groups, and some of the informants that were in our study had trained professionals to moderate these spaces, which was really great to hear. And a couple of our other informants who did not have such individuals in their organizations expressed a lot of interest in expanding into this area.
I have a comment related to the social media conversation, and then a question on a different topic. But regarding those sites that have misinformation, has there been any thinking about any particular trainings as to the best way to approach when you see messages with misinformation? Because people, as you know, they just become different online, and they, in a perfectly innocent message meant to correct some misinformation, all of a sudden can take on a whole different other life form, and people can begin attacking you and whatnot. So what's the thinking around that?
Yeah, I think it's really complicated because we see a lot of new parents are seeking out these unregulated social networks because they want to talk with like-minded individuals who are going through what they're going through, and they don't have great support networks, in their everyday lives. And so I absolutely understand that inclination of wanting to, have that camaraderie. I think like a big solution that was mentioned in our interviews was having these peer mediators within these spaces, which was really well received by a lot of our informants, and some expressed interest in, once hearing about the experiences around developing peer moderators, expressed interest in replicating that within their communities. So I think that's a really compelling option. Another thing that was discussed often was the opportunities around community baby showers. I think that's a really great way to get a lot of like-minded individuals in the same physical space. Of course, this was a challenge over the past few years with COVID, but there have been a lot of movements towards doing this more frequently in person. And then also within those spaces, you also have experts within the field who are able to guide conversations. So there are some exciting opportunities, but it definitely is a nerve-wracking topic.
And please note, if I have read your question out loud and haven't done it justice, or if you want additional follow-up information, please do come off of mute and ask for further clarity or ask a follow-up question. But Nina Nganga has a great question in the chat about applying a health equity lens as it relates to safe sleep and breastfeeding messaging. What are your thoughts on that, Rebecca?
Yeah, I think it's a really fantastic question. I think equity was a really sort of like a base level theme throughout this entire analysis, especially when we were talking about community level approaches. These are always developed with equity in mind, right? Like what is our promotion to safe sleep and breastfeeding that is going to work for the specific individuals that I am looking to serve, rather than taking a one size fits all approach, starting with the community and going up from there. I think like one of the strengths of a risk mitigation approach is that you get to meet families where they are, instead of sort of taking a didactic approach. It's like, tell me about your sleep environment. You know, it's being a little bit more open-ended in the approach and understanding the systemic factors that families are dealing with, whether that's a challenging work environment, not being able to take paid family leave, their socioeconomic circumstances.
Mm-hmm. Absolutely. Does anyone else in the audience have any other information you would like to share related to an equity perspective? The chat is just really jumping. There's some great comments in there actually about looking at intersections of historical racism and breastfeeding rates in Black communities. Have you known of any efforts to give more attention to that context?
Yeah, so this was a robust area of discussion in our interviews. There was a lot of discussion around like cultural views of breastfeeding and safe sleep as well. I know the particular instance you're referencing is related to breastfeeding. A lot of our partners within NAPSN are doing a lot of the work that you're referencing within their communities directly. Would say our role sort of as like the network that coordinates this effort is to uplift their work and to support them in, you know, in having these conversations within their community. And I'd be happy to point you to who some of our partners are more specifically, but I don't want to misrepresent the incredibly important work that they're all doing.
Thank you. I would appreciate that, because that's just something that we're really trying to get out here as well in RI. Thanks.
Great.
And I think it's so important that we do acknowledge that really painful history and the fact that there definitely is a connection, surely, between African Americans' history of having to be wet nurses and whatnot. It is a part of our history that we cannot ignore, that does definitely still have implications and ramifications to this day. So
yeah,
Thank you very much for acknowledging that to the person that put that in the chat. And thank you, Rebecca, and everyone else who's doing anything related to lifting up those messages and also trying to figure out ways to address it as well. I wanted to pivot to something that you had mentioned in the presentation about feedback about safe sleep videos, and wondering if there was a particular type of video or particular content in videos that seems to be received better than others.
Yeah, that's a really good question. I'm trying to recall back from our data analysis. There was some reference to some videos that have just some shaming messaging of like, do this, don't do that, you know, having this sort of like pedantic approach to education rather than being relatable in messaging. There was a lot of robust discussion about the usage of crib modeling. So there were some providers who talked about how they had a model crib that they would cart around throughout their facility to have like this physical space that that patients could interact with and see how to physically create a safe space and I'm sorry, a safe sleeping space, which was really well received, more so than the videos that were referenced.
Mm-hmm. And that also provides opportunity for just live conversation and discussion as well.
Right.
It really gives people a chance to really process more what their own thoughts and values are around issues.
Yeah, watching a video is highly theoretical, but you know, interacting with like a physical object, I think, at least from informants in our study, was really well received by their patients.
Mm-hmm. This is a really great conversation and a very popular session. At this point, we have 28 participants. So many folks joined and did miss some of our earlier conversation, but it's so nice to have you all with us. There are some messages in the chat about breastfeeding and its impact on safe sleep in terms of co-sleeping. And we haven't really engaged in any conversation about that yet, Miss Downey, so don't worry, you didn't miss it. So I'm just bringing it up right now.
Oh, thank you, thank you. Within our we definitely do have differences of opinions. So it's definitely a hard area to address. So if you have any feedback, that would be great.
Yeah, it was a topic that came up quite a bit within our interviews. I believe it was an exemplar quote that I shared that was really illustrative and said, you know, we're teaching these topics independently, but our families experience these topics together. And so we are starting to shift our approach to, you know, talk about these topics being intertwined. I don't really have anything incredibly additive beyond that. I know a lot of our informants talked about how to engage in conversations around the combination of safe sleep and breastfeeding in a really open and non-judgmental manner. There were several that requested more insights on how to have these conversations in a more open and non-judgmental manner. A lot of informants discussed shame that their patients experienced, you know, when they would admit to co-sleeping and the different efforts that they did to, you know, negotiate those feelings and develop a healthy relationship with their clients in order to create a safer environment for their children. So it's a really, really complicated and nuanced issue. And I think a lot of the solution to address it is really focused on that one-on-one connection, our second theme, which was relationship building and support.
Thank you, I appreciate it.
There was a comment in the chat about the role of fathers' involvement in infant safe sleep safety. Excuse me. This did come up a little bit in our interviews. There was quite a bit of discussion about the role of extended family and how it can be really difficult to get every family member on board to adhering to safe sleep practices. Even like a lot of the education being very focused on the mother, not necessarily also the father, if there's a heterosexual relationship. So this did come up quite a bit. I will say that there were not many solutions that were necessarily promoted amongst our informants, other than attempting to reach all of the family members through this very open messaging that I mentioned.
Regarding father involvement, I can give an example from my past life before I joined the staff at AMCHP in Baltimore City, but this is just in one particular neighborhood though. There's been a lot of outreach in barbershops, and we do show they do show the version of the video that was made for fathers. And also the barber himself is just like such a great advocate. So I know, Rebecca, you talked a lot about peer advocates, and having dads as peer advocates is really important too. And in that particular community, the infant mortality rate used to be one of the highest in the entire city of Baltimore, and now it is the lowest. And they actually went 3 whole years without a single infant death in that particular neighborhood, which is pretty well populated as well. That particular area is home to about 50,000 people. So we're talking about a significant area. So just a plug for the power of peer leadership, and also getting some business leaders buy-in as well.
That is such a fantastic approach. I am going to have to mention that to the team.
I can also get you in touch with the people that are still doing it.
Yeah, I would love to hear that.
Sure. To that end, are there any particular partnerships that folks in the audience would like to lift up and highlight that are going on in your areas that are successful? I think I saw something in the chat about a partnership between WIC and the health department, I think.
I see another comment about cosmetologists engaging youth in mental health discussions. I think that's so fantastic. There was also a bit of discussion in these interviews around providing education through faith-based organizations. So areas where individuals are already convening in a community setting, and using that as an additional locus for education.
Mm-hmm. Oh. And I also see the words that we can't seem to escape yet, COVID-19 pandemic. Have there been any particular implications of the pandemic around safe sleep?
That's a really good question. I think it's interesting. Of course, our data collection occurred in March of 2021, so the pandemic was, alive and well during that time, and continues to be. And certainly, our findings can't be divorced from the fact that all of these solutions were offered within that context. our interviews were conducted virtually, there's the possibility that we could have missed, some nonverbal cues because of that. That certainly impacts our results. I think it's also, it is interesting to note that our findings, I think, are very relevant for whether we are in a pandemic or whether it's more of an endemic state. I think our findings can be applied to public health contexts regardless of that status. But I do believe that there was quite a bit of influence of the pandemic, specifically on our first two themes on relationship building and social support and education and dissemination. Virtual approaches came up quite a bit throughout both of those themes, and I can only imagine that that would not have been the case had we conducted this study in March of 2019 instead. A lot of our informants spoke very highly of the opportunities to conduct education and relationship building virtually, but also would at times note limitations, that there's Zoom fatigue, and it's not as easy to physically inspect a space for whether or not an individual is co-sleeping, and that makes it more difficult to engage in those conversations if you're not able to really get a sense for what their space looks like. So certainly lots of pros and cons around it, you give and you take, but I am excited that this analysis can be used in both pandemic and non-pandemic contexts to promote safe sleep and breastfeeding.
I can also say from experience that the home visiting program that I used to oversee, and I'm sure many of you have experienced the same thing, had to do kind of we would call our pack and play deliveries UPS style. It's like, okay, we're just gonna drop them off just like we were driving in a brown truck, So definitely was not able to observe the safe sleep environment in the same way unless, we had our clients take pictures or whatever through the smartphones that we were able to give out. So, yeah.
Yeah, one informant did share, I recall, when she was conducting virtual visits, she would say, so describe to me what your sleep space looks like, right? Which is a really great open-ended question to engage with someone. And I think, those sort of conversational approaches are also supported by a lot of research. Like I'm thinking of Rachel Moon's work in particular. And I think that is a helpful way to overcome a little bit some of those barriers, but it's definitely an ongoing challenge.
For sure. We just have a little over 5 more minutes left, so I really do encourage you to please come off mute and interact with Rebecca and ask her anything, because I'm sure I've missed a ton of great things in the chat.
One idea that we had in RI was increasing the amount of breastfeeding consultants, because we realized that a lot of people in RI who are Black and brown are lactation counselors and not eligible for reimbursement. So that was one of the ideas that we had, but we're still figuring it out. But I'm just wondering, has there been any exploration on your part on thinking about how can there be more culturally competent people and diverse people serving the diverse communities, especially the ones that aren't breastfeeding as much? And just in general, your thoughts on it and any exploration on it.
That's a really good question. I so wish I had someone from the program side of my project that could speak to all of the amazing work that they are doing on this, but I unfortunately am a little bit not as quite directly embedded in the work that you're describing. I think the work we do as a network is to support all of our partners and our organizations in doing the work that you're describing. So I definitely want to, because I know you had another question about some of our other partners and the work they're doing. So I would definitely love to reach out to you after this and put you in touch with somebody who can answer your questions more directly, but I don't want to misrepresent the work that our partners are doing.
Okay, no problem. Thank you.
I'm looking forward to connecting.
Me too.
Yes, and we invite anybody who wants to have further communication with Rebecca to put your email addresses in the chat, and I'll make sure that those are saved and sent over for follow-up later as well.
I saw a comment about nighttime feedings, especially for moms preparing formula. This was definitely a robust area of discussion in this analysis. I think it's such a great topic to prepare parents for. I mean, when you're just bleary-eyed and just so exhausted and you have a crying baby, we had a couple of informants who talked about how they would implement nighttime parenting plans with their clients. So they would sit them down, you know, even before giving birth and say, you know, what is your plan when this inevitably does happen? Because this is the reality of being a new parent. And they would physically write down, like, first step is this, second step is this, third step is this. So, and a lot of time that could also involve partner support, as you mentioned, dads being involved too. So I think that was a really well-received tool among our informants, but it definitely is a barrier. And there's a question here about best or the right time to deliver safe sleep messages to parents and caregivers. There was a lot of discussion about this, and there's no consensus. We had a lot of providers who, you know, reported a lot of success in starting these messages prenatally. A lot of other providers said they felt like their communities were not receptive to that it was like too much information that was being thrown at them at once. You know, I think it's a really complicated topic, and I think it depends very much so on the communities that an individual is serving. But there was a lot of robust discussion throughout the entire analysis on this, with no particular consensus.
Yeah, I don't think that you could give the messages too many times, because you never know when it's actually when it will land. You know, people need to hear messaging multiple times through multiple audiences too. So, yeah. Rebecca, thank you so much for your time. Do you have concluding words for us, or does anybody want to express any final messages before we conclude the session?
Just going to pop my email in the chat one more time, and thanks everyone for being so engaged. This has been such a great discussion, and I'm, you know, thrilled to share this analysis with you all, and, you know, keep engaging with our work. We'd love to hear from you all.
It's really wonderful. Take care and enjoy the rest of your day and this last day of the AMCHP conference.
Thanks, everyone.